Good evening, viewers. Welcome to my show, Health is Wealth. I hope you are all doing well. So, viewers, as you know, this is Health Awareness Program, and I try to focus on those community-based issues and try to bring those health issues which are related to a community. So this time I'm trying to focus on drug abuse. This is a very hot issue in our community also, and as you know, with the drug abuse, people are losing their lives, our youth is getting involved in it, and parents and youth relationship and all these matters in preventing the drug abuse. And so I thought I should bring this issue into my program also. And I have invited a young graduate, medical graduate, who is a young doctor, freshly graduate from Atlantic University. And he has, because the point of inviting him, he's a young man and he's the voice of youth, so he can be easily explaining because he has worked with as a clinical rotation in Chicago with the drugs abuse patient also. He has experience with the psychiatrist and the patient, addicted patient, and he has treated and has worked in a rehab center. So I have invited him. His name is Dr. Harun Chaudhry. So welcome, Dr. Harun. How are you doing?
I'm well. Thank you for having me.
So as you know that our youth is having this problem of drug abuse. So I'm honored to invite you to relate the youth topic from a youth young blood, so that easily communicate the problem with the voice of youth. So that's the reason I called you today in my program. Okay, so I will ask you some questions related to drug of abuse. So basically, tell the viewers what are the drug of abuse.
So the drugs of abuse is a category that encompasses not just illegal or illicit drugs, but also drugs that we can get with a prescription from the doctor, or some drugs that are legal. And the reason they're called drugs of abuse is that their potential for abuse is so high because they're so addicting that it causes those who use them to just use them again and again and abuse them. And that's why they're called drugs of abuse.
Right. So what are the dangers of drug abuse?
So the dangers with the drugs of abuse, really it comes in 3 stages. When you're taking a drug, you get intoxicated. So that's the first stage, is intoxication. The second is that you can have an overdose. And the third is withdrawal symptoms. So let's talk about intoxication. When you are taking a drug and you become intoxicated, you can either walk into a dangerous situation, right? You can try to operate heavy machinery in which you're not just putting your life in danger, but the life of others as well. Or you can try to drive. These are all, things that you shouldn't be doing when you're intoxicated. The second is an overdose. So the thing is, when you're taking drugs, the first time you need a very small quantity to achieve the high or the buzz that you're looking for. But as your body becomes dependent on that drug, you need more and more quantity of that drug to achieve the same high, the same buzz that you got the first time. And that's what drug users are looking for. They're looking for that pleasant feeling, the feeling of happiness, euphoria. And, to chase that, they can actually get an overdose. And overdose symptoms range from seizures to cardiovascular collapse.
Right.
And then the third thing is withdrawal. When you're taking drugs for so long, any one of them, your body can become used to them and it becomes unable to function without those drugs. So if you've been taking a drug for a long time and you suddenly stop taking that drug, again, you can have symptoms ranging from seizure to life-threatening cardiovascular collapse. This is why it's so important that you don't take, drugs immediately away from somebody who's an addict.
Yeah, withdrawal effect.
You think you might be trying to help them, you're actually, you might harm them.
Yeah.
And this is why they need help and they need to get into a rehab clinic. I think the most obvious danger of drug abuse is the amount of time and money that a drug user would spend on getting that drug. You know, instead of spending that money on food or, you know, shelter or kids if they have them, they spend it on drugs.
On drugs.
Also increased isolation and withdrawal from their own family. And you can get fired from a job as well. So those are, I think, the social aspects of it are the real dangers.
Right. Now, we know about some of the drug abuse, like by the name of heroin and cocaine. But what about those were legal drugs of abuse?
Right. So the illegal drugs of abuse, which we all know are the, you know, the big ones, the heroin, the cocaine, the fentanyl.
Fentanyl, you have mentioned fentanyl. About 4,000 Canadian youth have lost their life by taking this fentanyl. And you know, this is very high number.
Right.
Within a year, 4,000 Canadian have lost their life, and young people.
Right.
So yeah.
So the legal drugs of abuse are alcohol, which has been legal. It was illegal at one point from 1920 to 1933. It was illegal in the United States and Canada, yeah. But it is legal now. Nicotine is legal, and caffeine.
Yeah,
and
nobody thinks that caffeine will be a drug of abuse.
Caffeine is actually the most common drug of abuse. But the thing with caffeine is that it has very little negative effects on your health. But the thing is, the principle of tolerance still and withdrawal symptoms still applies to caffeine. Your body can become so dependent on caffeine that if you try to stop taking it, you can experience laziness, fatigue, irritability. Nicotine and alcohol are legal drugs of abuse.
Nicotine is like everybody. A lot of people are using nicotine.
Right.
And
right.
They don't take it as it may cause like withdrawals symptoms and all those.
Yes.
Things. Yes.
Nicotine actually has
alcohol. Alcohol is the number one cause of death in youth, in adults, in every the span of life. If you are using alcohol, this is the number one cause of death.
Yes.
In Canada also, and in the whole world.
Yeah. Driving drunk.
Yeah, driving drunk is
very. You're putting other people's lives in danger, not just your own.
Not just yours.
And did you know alcohol actually has one of the most interesting withdrawal symptoms? If, for example, if a patient has been hospitalized for 3 days, he's not getting that alcohol, he will start seeing insects and cockroaches on the ceiling.
Yeah,
he'll start shaking. Hallucination. It's called delirium tremens. It's you know. So again, I mean, not just the illicit and illegal drugs are bad. It's also the legal ones. And also the prescription drugs that you can get from the doctor. For example, ADHD medications, benzodiazepines, which are anti-anxiety, like Xanax to clonazepam, and also prescription painkillers.
Yeah, my next question was, what are some prescription drugs that can be prescribed for health reason to treat certain diseases but can turn into drug of abuse?
So the first one I can think of off the top of my head is are the ADHD medications. ADHD is attention deficit hyperactivity disorder, and it is a very real thing, and it affects young children and even adults. A lot of people go undiagnosed. So the medication for ADHD is, Concerta, Vyvanse, Adderall. These are some of the brand names. So these medications are basically amphetamines. They work like amphetamines, and they can give you in higher doses. Yes, in lower doses they promote wakefulness, they promote attention and concentration. That's why they're prescribed to ADHD patients. But in higher doses they produce euphoria, and that euphoria is such an intense feeling of happiness that you can crave it, you can go for it. Yeah.
Yeah. You feel better, and then you want to take more.
You want to take it again, and then I think the biggest danger with ADHD medication is that students tend to take it a lot.
Oh yeah.
Even those who don't have ADHD, they seek it, they buy it, and people sell it in the libraries where students are studying during exam time. So the thing is, when your doctor prescribes you an ADHD medication, he knows the dose to give you, and he knows how much you need. But when you buy it from an untrustworthy individual in an unknown dose, you really don't know how much you're taking and how it's going to affect your body. And a frustrated student can very easily take more than he needs to. and get an overdose of amphetamines, basically. The second prescription medication is Xanax. So it's for it's an anti-anxiety. So you know in today's society, there are a lot of stresses. There are financial stresses. We recently recovered from a recession. A lot of people lost their jobs. So, you know, stress is a big thing. And a doctor might give you Xanax, like benzodiazepine, just to calm you down, to relax you, to lower your blood pressure. It's for your own health. But they can be so habit-forming and addicting that if you try to stop them, you won't be able to. You will need help to taper off of it. And again, the danger is that it can be prescribed to a certain individual in the household and be taken by another individual in that household. The same with oxycodone and Percocet and Vicodin painkillers and codeine cough syrups.
Yeah, see how these drugs may cause you. It can be like it's good for your some people, but it can be drug abuse for others. So इसीलिए कहते हैं कि दवाइयाँ बच्चों से दूर रखें, दवाइयाँ यूथ से दूर रखें, स्पेशली जब आपको Xanax और बेंजोडाइज़ेपिन जैसी ड्रग्स आपको डॉक्टर ने प्रिस्क्राइब की है, तो आपके घरों में तो मौजूद है, लेकिन आप ये नहीं पता कि आपके बच्चे उससे एडिक्ट हो सकते हैं. आपके बच्चों के लिए वो ड्रग एब्यूज़ हो सकती है. आपके तो काम के लिए है, लेकिन उनका काम खराब हो जाएगा. तो इसीलिए it is always said to keep the medicine away from children, and now this type of medicine keep away from youth also. So we will be coming back after the short break. So stay tuned. We will ask some more questions to Dr. Harun.
मैं हूं जहांगीर खान, स्क्वाश कोर्ट का चैंपियन, लेकिन रियल एस्टेट इन्वेस्टमेंट का चैंपियन मोहम्मद कामरान हुसैन. मुझे उन पर यकीन है, आप भी करके देखिए.
जहांगीर खान और हजारों क्लाइंट्स का चहेता मोहम्मद कामरान हुसैन. रेजिडेंशियल प्रॉपर्टीज और इन्वेस्टमेंट्स दोनों के लिए ही सही मशवरा, सही फैसला. मकान जिसे आप अपना घर कहने में फख्र महसूस करेंगे. मोहम्मद कामरान हुसैन, 4163185264.
Welcome back, viewers. So we are with Dr. Harun and we are talking about drug of abuse, and he has already mentioned some of the drugs which are like opioids and for the anxiety and for the ADHD, and the other drug which is now going to be legalized in Canada in July. So I just want to talk about that also, and that is marijuana. So Dr. Harun, what about your about marijuana, which is also can be used as drug of abuse?
Right. So marijuana is a very controversial topic, and it's a hot topic in the media and in politics. So marijuana is recently gained, the legal status in many U.S. states, and now it's going to be legalized in Canada. It's also been legal for many years in countries like the Netherlands. And before it was legal, made legal to the public, or before they were even thinking of making it legal to the general public, it was made legal in some states, in some countries, for use as medicine. And so even that, they're using marijuana to reduce vomiting and nausea for those patients who are taking chemotherapy to fight cancer. That's one use. They're also using marijuana to promote good appetite in those who have HIV and AIDS. And that's another thing. Marijuana is also known as cannabis, which is the plant family that it comes from, or weed, which is how it's known on the street. So marijuana has many benefits, and also has some harms. So many of the research, medical research that goes into marijuana, and many of the research that talks about its long-term harms and benefits is lacking. And the thing is that the reason it's lacking is because it's so hard to recruit people who are willing to come forward and say that they are marijuana smokers.
Oh, yeah.
Because it has been illegal for so long, nobody wants to come forward and say that they smoke marijuana. And even if they do, they don't want to say how much they smoke. And the thing is that marijuana smokers actually also smoke cigarettes. So how can you purify that study from that from the effects of nicotine?
Nicotine, right.
Right. So recently, marijuana was tested in clinical trials for the treatment of Alzheimer's and dementia, and it showed good results in that trial. But then a peer review of that study shows that the quality of the study was not sufficient and that the evidence is really lacking. More research into marijuana went for its anti-cancer effects. One study showed that it has anti-cancer effects. And again, a peer review of that study showed that the evidence is again lacking because the quality of the study was not good at all. Right? So there are a lot of things in the air about marijuana that it prevents dementia or it has anti-cancer effects. The thing is that this is just one study, and one study never has shown to be a good resource to rely on. Many of the medicines that are passed have gone through rigorous studies, peer reviews, many clinical trials before they become safe for use in the medical setting. So really, I feel like medically right now, the only thing that marijuana is good for is for anti-nausea, anti-vomiting.
And pain.
And pain. Yes.
For the terminal illness patients,
yes, and
like cancers and those patients, marijuana is good to reduce their pain.
Yes.
And this is the use of marijuana. But those who take it as drug abuse, we have to keep an eye on our youth that they don't take it illegally.
Yes.
To prevent they have harm on their IQ level. You were telling me.
So, some of the harms of marijuana are that if adolescents smoke it, it can actually cause decreased connectivity between their neurons when their brain is developing. And that decreased activity can actually lead to a decline in IQ by 38 if you take it before the age of, your early 20s. Because your brain is still developing. If you start using marijuana after that, then it hasn't shown to decrease your IQ. But before that, in adolescents and developing young adults and children, it is very harmful because it will decrease your IQ. And you will also, marijuana promotes laziness and fatigue. How are you supposed to do your homework or concentrate if you smoke marijuana and now you feel lazy, you feel tired, you can't concentrate. Also, I feel like the greatest harm of marijuana comes from the fact it's called the gateway drug hypothesis. And the gateway drug hypothesis is a theory that suggests that since marijuana has been illegal, when you're trying to get a hold of it, you will come into contact with the person who is selling marijuana might be selling other illegal drugs as well. And he may ask you or, persuade you to try the other drugs that he's selling. Or you may want to try the other drugs that he's selling, right? And this is how you can go from just smoking, marijuana to taking cocaine or fentanyl or heroin or PCP or LSD or any of the other drugs that are harmful to the youth.
Right.
And these memory problems and the cognition problems are really the biggest harm, I think.
Of marijuana in youth. That's why government is legal. I think that's why government is legalizing it, to prevent this illegal trade of drugs. So that the other thing is according to the government, that by the legalization of marijuana, because marijuana is the top class in Canada, and it will affect the revenue of Canada also because it will export this. And this is being used for the medical purposes, for those patients who really need marijuana to prevent, to subside their pain, to those patients who are terminally ill patients, to relax them, to relieve them from pain. It is not for the youth to entertain yourself and to make your life, instead of like relieving in the terminally ill patient, for the youth, it make their life into hell, like they are destroying their life. So for the youth it is not good, but again marijuana has good effects medically. So that's why if it is been legalized, that means the government doesn't want the youth to take it illegally, and there will be a restriction of age while giving the marijuana to the public. So with this point, we are going to continue this with Dr. Harun, and we will talk about addiction and how we will come to know that daughter or son is using drug, what are the symptoms in them, that the parents can know and parents can find out why their son or daughter is behaving differently. They have to keep an eye on it. So we will discuss this. So stay tuned.
रंग वाली भरम वाली न्यूज वाले व्यूज वाले भेल वाले मेल वाले कराची वाले खैबर वाले लाहौर वाले पिंडी वाले इन शॉट पूरे पाकिस्तान वाले चिली मिली के हमत वाले कैंडीलैंड चिली मिली.
Welcome to the episode of drug abuse in Health is Wealth. So we are continuing the same topic, like drug of abuse. So we are with Dr. Harun, and Dr. Harun, tell us about something addiction, when we use these drugs and then we get addicted to it. Mm-hmm. So what is addiction, and how to overcome from addiction?
So basically there are two types of addiction. There's psychological addiction and there's physiological addiction. So psychological addiction is the addiction of the mind. It's the pleasant, the happiness, the pleasant feelings that you get when you smoke a certain drug, like nicotine, or when you take cocaine. That all builds into psychological addiction. Also, for example, with smoking, you might smoking is a good opportunity to go outside for a break, chat with your friends who also smoke. That all builds into psychological addiction. With alcohol, you might like going to a bar with your friends on a Saturday night and drinking, and that also builds into psychological addiction. And then there's physiological addiction, which means that your body is addicted physically. With physiological addiction, you have, for example, we have neurotransmitters in our body, and that's how our body communicates with the other cells. When you take cocaine, your body releases a whole bunch of neurotransmitters, like serotonin and dopamine, which are feel-good neurotransmitters. Also some, adrenaline, like norepinephrine and epinephrine. So when your body releases so much of these neurotransmitters, your body craves that again, and nothing else no other stimulant can match the release of neurotransmitters that comes with taking these drugs, like cocaine, hard drugs. That causes physiological addiction, and with the example of nicotine. And nicotine especially, because smoking cigarettes is increasingly popular with the adolescents, and there's something even more these days. It's with the new uprise of hookah lounges and shisha lounges. A lot of adolescents and youth go to shisha lounges and they smoke there, and they don't check any ID, they don't check to see if you're 19 or... Right. But that doesn't matter. What matters is that the harmful effects of nicotine are still the harmful effects like cancer and heart disease, whether it's smoked out of a hookah or whether it's smoked from a cigarette. It's not any less. Right. And the thing with nicotine, the reason nicotine is so dangerous is that we have nicotinic receptors in our body. When we take a lot of nicotine, the quantity of those receptors increases. This is why then your body depends on nicotine to come and bind with those receptors.
Right. And in the same way, opioids, which are given for the pain as a painkiller by the doctor, like these are the prescription drugs given by the doctor, but then they are because they want more and more, and then overdosage of it.
Yeah.
So this also causes addiction, right?
Yes.
So
for example, like a doctor might give you Percocet or Vicodin or oxycodone, as it's known generically, for pain that, like if you fractured a leg after surgery, this is when they give you strong painkillers. These are opioids, which is an analog of heroin. So when you take these, for example, for 30 days or 14 days, you might like the way they make you feel, the way they take your pain away, all of it. And you might fake your symptoms with the doctor to get them again. This is called malingering. It's when you fake. And when I was working in the ER, we actually had a lot of patients come in and malingering, just drug-seeking behavior.
Right.
Sometimes they actually fracture their own bones just to get that again, until they realize that, hey, it's actually cheaper and easier if I just go buy heroin on the street.
Oh, no.
So that's when they go from prescription painkillers to heroin. And another very dangerous opioid these days, fentanyl.
Yes.
And obviously, a doctor, again, will give you a controlled dose. He knows how much to give you. He knows your body weight, your age, your gender, how your body is working. But if you buy it on the street, you don't know how much heroin to take.
Right.
And again, the way heroin is taken is that it comes in a powder, you put it in a spoon with a lighter, it melts into a liquid, you put that in a syringe and you inject it into your arm. You can already imagine the dangers with that.
Right.
First of all, infection. Second, if you're sharing needles, HIV, AIDS, sexually transmitted diseases, which is why HIV and AIDS are so common in heroin users. And, you can see track marks on their arms from, sometimes they need an amputation.
Yeah. Oh my
Because of
God,
how
that's
bad
so
the infection
bad,
gets.
yeah. So, this is a question for parents also to get aware of if their child is in drug. How can we identify those who use drug?
So it depends on the drug you use. Every drug has its own set of symptoms or signs that it will bring on when you're intoxicated with that drug. For example, cocaine intoxication will give you dilated pupils, which is when the black part of your eye gets very, very dilated. Heroin intoxication will give you pinpoint pupils, which is when the black part of your eye becomes very, very small. Marijuana intoxication will give you red eyes. It's called conjunctival injection.
Oh, yeah.
And drooping eyelids. So you'll see drooping eyelids and red eyes.
Yeah.
Also, marijuana has a very distinct smell. For heroin, you can check the track marks on somebody's arm or legs. Sometimes they inject it into their legs. You can actually see these track marks.
And then their behavior also changes.
Exactly.
Right?
So
eating habits change. And then I have seen they ask for money from the parents,
Exactly.
because they have to buy from. So these are the stigmas which alarming sign that the parents should ask their child what is going on, and then it should be in a very friendly way, not like if they're taking the drug, then immediately you have to stop them. No, this is not the case. Tell us about this.
Yeah, so what I mentioned about dependence, your body becomes dependent on that drug and then needs that drug to function properly. If you immediately, suddenly take that drug away from them, they can develop seizures. In severe cases, they can even develop life-threatening cardiovascular arrest. So it's really important that you don't take drugs immediately away from somebody. They need help. And most of the time, they themselves realize that they need help, that what they're doing is not healthy behavior, that they should stop, and they need help stopping. You can't take it immediately away. You'll do more harm than good. You need to get them in a rehab clinic, or there are hotlines that you can call. And they need the attention of a psychiatrist that can not just break the physiological addiction by weaning them off. For example, with opioids, we can give naloxone or Suboxone. With smoking, we can give Vincristine, which is, the Nicorette inhalers and gum. This is how you break physiological addiction, and a psychiatrist can also help break the psychological addiction. And also, love and care also bring about the same release of neurotransmitters like dopamine that drugs can bring about. So if they get that love and care from home, and if they get the attention of a psychiatrist, they can overcome drug abuse.
Yeah, thank you, Dr. Harun. You have
You're
given
welcome.
us so much information about drug abuse. So, viewers, this was our topic on drug abuse, and I would again say, parents, please take care of your children and be friendly with them, and be close to them, and उन पे आँख रखें, उन पे नज़र रखें और उनके साथ फ्रेंडली वे में उनसे बातें करें ताकि वो इधर उधर जाने की बजाय आप लोगों के साथ वक्त गुजारें और आपको पता हो कि क्या कर रहा है आपका बच्चा. The other thing is for the children, for the youth, I would want to say that they should know how to say no to drug. अगर if your friends are taking you towards that side, please say no to drugs and change your friends, change your company, because that matters a lot. It will ruin your life if you will go and listen to them. So you should say no to drug. The other one thing I want to mention about Unity in the Community organization is organizing a seminar on drugs abuse. And Dr. Harun, you are also coming in that
Yes.
for the presentation,
Yes.
and different other speakers are coming. So please attend that seminar on 25th March, and we will let you know where it is. Can you tell us about which community center it is?
It's in the South Fletcher's Community Center, which is on Ray Lawson and McLaughlin in Brampton.
In Brampton.
Yeah.
So please attend that seminar also. And with these words, I would say goodbye to you. Take care of your children, take care of yourself, and goodbye.